Snoring is the result of the rush of air caused by the obstruction of this airway. When someone snores, their tongue flaps back, their palate closes off, or both. Advancing the jaw using a mouthguard is a clinically proven method that maintains an open airway. The American Academy of Sleep Medicine recommends oral appliances for those that snore or who have sleep apnea. SnoreRx is a medical-grade, custom-fit, modular mouthguard that is comfortable to wear at night. What sets SnoreRx apart from its competitors is its micro adjustment feature, which delivers maximum patient comfort and clinical effectiveness. Even custom dental mouthguards costing $2,000 to $3,000 cannot deliver this kind of micro adjustment without the use of screws, nuts, bolts, or hardware, which can chip the teeth or be swallowed while sleeping. SnoreRx is the only product on the market that meets the new 2012 Medicare Design Guidelines. I recommend SnoreRx to my patients because it is clinically effective and safe. The company feels so confident that you will love SnoreRx, they give 100% unconditional guarantee or your money back.